Anna comes to my office in despair. She can't take it anymore. She has unbearable pain in her shoulder, but above all, she's frustrated. She's given up because she has always done everything for her family. She is a grandmother, a young grandmother. She has always helped her daughter with the grandchildren. She has always taken care of them, cooked for them, and now, with this painful shoulder, she can't even lift it anymore. She comes into my office desperate and also a bit confused by the journey she's been through, and by all the information that hasn't always pointed in the same direction. But let's try to understand why Anna is so frustrated. Because without being able to lift her shoulder, she's no longer independent in dressing herself, washing. She can't put on or take off her jacket. She can't reach to grab a plate when it's on a high shelf. And the people who watch her eat ask her, "Why do you lift your elbow so much just to manage?" So Anna is in this situation, and keep in mind that just a month ago, before that fall, she was completely fine. But let's take a step back. If we ask Anna about her journey, she remembers something, and it's something from almost 10 years ago. She had a slight pain in her shoulder and had gone to her family doctor, because she's someone who looks after herself, who takes care of herself. She went to her family doctor, who, after noticing this little pain, gave in to her insistence and had her get an ultrasound. And during the ultrasound, the doctor put on a reassuring face. He told her it was just some wear and tear, a slight fraying of the tendons. And then she had also gone back to her family doctor, who told her it was periarthritis. She had already heard about it. Many of her friends suffered from this periarthritis. And so she felt reassured, and the doctor even suggested an injection. She had this injection done. She no longer remembers what it was, but she does remember that almost immediately, after a day or two, she felt much better and went back to her carefree life. Normal. After all, as everyone knows, as you get older, a few aches and pains can show up. And so she was able to return to all her previous activities. Sometimes, if she did a bit more, she would feel a little discomfort, but a bit of arnica helped. An anti-inflammatory now and then without overdoing it. And the pain was still under control. At a certain point, her daughter decided to move house. The move was something that involved the whole family a bit, because it's true that there are companies that come and move your furniture, but you still have to prepare some things yourself. And there was that bookshelf that needed to be emptied. And Anna took care of that. She packed all those books into boxes and got them ready to be taken away. Well, after that day of work, in the evening, she already felt that something wasn't quite right. That night was hell, and the pain was unbearable. Nothing could relieve it. She had taken the anti-inflammatories she had at home, but to no avail. That night had truly been hellish, and once again a worry crept into Anna's mind. Of course, talking with her friends, there was already someone who had had a similar problem, and she had gone to see a physiotherapist. So Anna gets Marco, the physiotherapist's number, and goes to him for therapy. The physiotherapist examines her, looks at that well-known ultrasound that was already 3 years old by then. And he says, "All right, it's a bit of periarthritis, let's continue with some treatment." She had undergone tachytherapy, felt better for a while, and then, with some exercises, managed to keep the problem under control again. So, the alarm was over, the physiotherapist had done his job. He had also given her some exercises to do at home, which she did from time to time. Sometimes yes, sometimes no, because overall the situation had remained under control. And from that moment on, things went on like that for many years. At a certain point, though, Anna has something to do. She needs to get something from the top of the wardrobe. Those heavy coats that you put away during the summer and take out again in the winter season. While getting these coats, she climbs up the ladder and, coming down with her hands full, she misses the last step and falls hard on her poor shoulder, the same right shoulder as always. Well, at that moment she gets very scared, because the pain almost makes her faint. She goes to the emergency room where, after a long wait, she finally manages to get an X-ray. The doctor reassures her, saying, "Look, you were really lucky this time. You didn't break any bones." He tells her to go home, prescribes her an anti-inflammatory, and Anna continues taking this medication. And I have to say, the pain goes away in 2 weeks. The problem is that this shoulder doesn't move. She can't lift it. The first thing she does is go back to Marco. Marco tries physiotherapy, exercises, and treatments, but nothing works. Maybe the pain gets a little better, but the shoulder still won't move. How is that possible? So she goes back to her family doctor. All things considered, the doctor sees that the situation isn't quite normal and orders an MRI scan. The MRI report said there was a lesion, a tear in the rotator cuff tendons. This is alarming. It's alarming even for the doctor, and finally she is referred to see a specialist. Anna comes to see me in this condition. The doctor told her, "Go to the orthopedist because you need to have these torn tendons repaired." When she comes to see me, Anna is extremely worried. Her arm won't move, she can't lift it anymore, and people are starting to notice, even during everyday activities. They ask her, "But how come you can't do this?" Well, there are 2 torn tendons visible on the MRI, but these torn tendons in the eyes of a shoulder surgeon are something much more concerning. More concerning than what worried the family doctor, the problem itself. Because these tendons aren't torn just now, they're the result of all the years Anna dragged this problem along without addressing it, not through any fault of her own, because they told her it was arthritis, they told her there was no problem, she did feel better with the exercises, but we missed the chance to address it when the injury was still repairable. Anna is shocked when she's told that these tendons are no longer repairable, because she says, "But how? I've always felt fine, I've never had a problem, it was just the fall." Well, the fall was the straw that broke the camel's back. And now these tendons can no longer be repaired. There are solutions, and we'll look at them. This is indeed the most common and frequently observed path for many individuals who are gradually approaching their golden years, those who have consistently and diligently moved forward throughout their entire lives, always prioritizing and taking exceptional care of the well-being and needs of others, often putting themselves second. So, Anna's story teaches us 3 fundamental and important things about the shoulder. The first thing is that the shoulder has an enormous capacity for compensation. What does that mean? Shoulder movement happens through a combination of actions between the scapula, the glenohumeral joint, the rotator cuff tendons, and the stabilizing tendons of the thorax. All of these muscles, tendons, and joints work together in sync to allow us to move. If just one tendon in this entire chain gets injured, and if this tendon is damaged gradually over time, meaning without any trauma, our body compensates for this deficiency by making the other structures work harder. In fact, the rotator cuff is connected by something called the cable, which is a thickening of these tendons that, as long as it remains intact, allows the force from these muscles to be transmitted evenly to the humerus, enabling us to move our arm. However, over time, this compensation can be lost if the tear gradually gets larger. Just like a rope that's starting to break, a tendon also gradually loses its mechanical properties and, little by little, frays and crumbles more and more. Sometimes the patient says to me, "Well, my tendon is frayed, it's torn, it's damaged." Well, for the orthopedic surgeon who specializes in shoulders, there isn't much difference between these terms because a tendon that starts to tear is a tendon that, more or less quickly, and there are certain criteria we can look at to understand whether it will be a tendon that will tear more or less quickly, will eventually rupture. As it tears little by little, our shoulder will compensate. This process, from the outside, we won't notice it, or we'll only notice it during more strenuous activities. We do something a bit more demanding and the shoulder gets inflamed. Maybe we used to have a strength of 100, now it's 90, but still nothing that would make us stop our routine or the things we're used to doing so very, very, very often. This problem is not very alarming. So first of all, tendon injuries occur over time, and if they happen slowly, they are well compensated and show very few symptoms. Secondly, it's common among people, among general practitioners, and even among orthopedic surgeons who don't specialize in shoulders, to hear that. People say the shoulder has a problem with periarthritis and that it's not a serious issue, that it's just normal aging of the shoulder. Why do people say this? They say it because originally, the only problems considered serious for the joints were those that prevented us from walking. That was the beginning of orthopedics. The lower limbs were considered more important than anything else since the shoulder, after all, doesn't affect our ability to walk. It was something that could be somewhat overlooked. There were fewer studies on shoulder pathologies, so anything that happened in the shoulder was classified as periarthritis. That is, itis meaning inflammation, arthur referring to the joint, and peri meaning around, so an inflammation around the joint, implicitly, of the shoulder. You can understand that this is an extremely generic term, which no longer makes sense to use in modern times when we know every pathology. What causes shoulder problems? So it's a bit, let's say, rough to classify this problem as periarthritis and leave it at that. Okay, there's a problem that we think is this inflammation of the shoulder. Let's do the proper test to understand what it is, what is causing this inflammation, and let's try to treat it or monitor it. Even sometimes a small supraspinatus lesion, like the one Anna might have had at the beginning, could also be monitored over time, but certainly not neglected. A single ultrasound in 10 years, as you can imagine, only identified the problem once and in a rather simplistic way. And then it was never addressed again. Whereas, on the other hand, by properly classifying that lesion with an MRI and understanding its potential progression, it could have been said to Anna, okay, live your normal life, but remember, every 2 years we'll check this lesion with an MRI and see if it's progressing rapidly. That way we can intervene while it's still possible to repair it. And this brings us to the third point, the third lesson we learn from Anna's story. How are tendon lesions treated? Tendon lesions are treated when they are detected early, meaning when we catch them quickly by repairing them. Why isn't it always possible to repair these lesions? Because the tendon is attached to a muscle and the muscle isn't working. Because the tendon detaches, undergoes atrophy, it atrophies, meaning its size decreases. This reduced size is a factor that causes the tendon to move away from where it is normally attached, and on top of that, the muscle that isn't working is replaced by fat. After a certain threshold of retraction and, let's say, muscle resorption and replacement with fat, it is no longer possible to perform a repair. Because even if, with a surgical technique, I manage to free the tendon completely, to mobilize it, once reattached, this tendon will no longer do its job. Why? Because behind it, it no longer has the engine. The muscle has been resorbed. So in acute injuries, those that are not retracted, and where the muscle is still good, we can perform a surgical tendon repair. That is, with arthroscopy, using cameras, I enter the shoulder joint and reattach the torn tendon with these sutures. Then there are chronic traumatic injuries, meaning they are mixed. It's an old injury that has retracted, the muscle has been resorbed, and it's been significantly worsened by a recent injury. So in these cases, accepting a potential risk of failure, one can also consider a selective repair, meaning to reattach only the part that has just torn, which is usually the part behind this well-known cable that distributes forces in the shoulder. So, with an arthroscopy, you can go inside the shoulder and selectively reattach only the most recently detached part. It depends a bit on age and a bit on the luck of how it tore. And in a significant percentage of patients, you can achieve a good result. Clearly, these are patients who need to be highly motivated and to whom it must be explained that this procedure might not deliver the expected results. The third option we have is for chronic injuries. A tendon transplant from the back, meaning using a tendon from the dorsal area to bring it into the shoulder, to take over the function of those tendons that are torn and can no longer be repaired, though with a certain degree of compromise. This too can improve the patient's condition, even if it doesn't result in a completely normal shoulder. And finally, in cases where it is no longer possible, or the patient is too elderly to undergo a muscle tendon transfer, we can perform what we call a reverse prosthesis procedure. This means replacing the joint so that it can function without pain, using the prosthesis as a stabilizer, thus making it possible to do without the rotator cuff tendons. In conclusion, if you have a shoulder problem that you've been dealing with for a long time, even if it's just a minor discomfort, something that doesn't completely compromise your abilities, your functional abilities, take care of it, because it's important to find out as soon as possible what is wrong with your shoulder and to take care of it as soon as possible so that you can either stop this tendency or at least be aware of it and monitor it over time. If you have suffered a trauma and after going to the emergency room you can no longer move your arm, do not hesitate to see a shoulder surgery specialist. Because if it is addressed immediately, there is still a chance, most likely, to do something about it. In some cases, which are purely traumatic, there is the possibility to repair everything and return to having a completely normal shoulder. On the other hand, if you have had a shoulder that you haven't been able to move for a very long time, don't give up hope, because there is an alternative possibility through a prosthetic surgery to return to normality. Let's not allow Anna's story to influence our decisions.